The mission for the Department of Surgery is the pursuit of excellence. And it's not a mission that is based on just a statement, but we live it by the moment and by the hour.
I would never consider not working in an academic environment because I love teaching.
Providing high-level, excellent care to every patient, no matter where they come from, what they look like. We take pride in doing that.
Each time that I came into the office or when I was here inpatient, I felt like I was the only patient in the hospital.
The critical mission for us is to provide excellent care. People come to us seeking care at the time of the greatest need, and we should be able to provide that the best way possible and also in an efficient way and in a safe way for them.
At VCU, we have so much to offer with all of the different specialties and practices. The depth and breadth of the services we provide is extraordinary.
My case was too complex for the other health system, so I decided that VCU probably would be my best option. When the provider came in, they had already reviewed part of my case and kind of had a plan for me before I even got here. I felt 100% confident when I came in for surgery that day. I received a call the next day, making sure that I had made it home okay, making sure that I had all my discharge information.
You really need to start planning for success the very first time you meet the patient. What exactly do they need surgically and medically to be successful?
Our patients are really part of us. We encourage our patients during rounds to bring about what they think about the plan of care. We engage them in everything else we do. And I think that really is where excellence can only be achieved, when patients are not seen as clients, but as partners, as part of the team.
I think, clinically, you kind of get diverse opportunities from the patients you see, and then also the diversity in the diseases and disorders that you're able to see.
When you work at a place like this, you see things that people out in the community, people who don't work at a place like this, will never see in their entire lives.
At VCU, the whole aim is to provide one of the best surgical outcome models in the country, and it's based on enhanced recovery after surgery. Instead of just rushing patients in for surgical operations, we get them ready for surgery and optimise them and educate them on what to expect during surgery and after surgery.
Without research, we will not advance knowledge. And that actually is a unique mission for us. How can we give this medication better? How do we perform this surgery better? How do we move patients through in a safe way that gives them an optimal experience? All that innovation is critically important.
In our laboratory, we're actually modeling the human bladder. One of the things that we're looking at specifically is how blood flow or ischemia can lead to conditions of bladder dysfunction or voiding dysfunction. So what my patients want to see is that we're working on new strategies to improve their quality of life, and this is a way that we can do that really quickly and efficiently.
I am able to collaborate with people who do disparities research, which is a big interest of mine, which was also something that really drew me to VCU. We're really studying real people and real situations so that we can come up with real answers.
We train everybody, nursing staff, pharmacy, paramedical, everybody. So I think that's a critical part of what we do.
Nationally, let's say for instance bladder cancer patients who require a cystectomy, you're considered an expert if you do 10 to 20 in a year. And I reviewed my cystectomy numbers and I was at 22 cases. That's just for this year. That's not including the entirety of residency.
The opportunity to teach residents and medical students, it keeps me fresh, it keeps me constantly learning, and it also allows me to see my operation through new eyes every single day.
Our trainees provide the extra set of eyes, and they're attentive to detail. They care for the patients like it's their family. I call it the ecstasy of operating. You're in a zone where things are moving smoothly and everybody's working together as a team and everybody's focused on the same things. I find that my day-to-day, that's the least stressful part of my day.
It is the most comfortable feeling in the world. I love my OR days. When you hit your stride and it's just feeling like it's coming natural and everything feels great.
Every surgeon in this department that I've witnessed really takes pride and ownership in what they do.